is Shama, and today the health policy issue that I will be speaking on is the issue of the Overdose Prevention and Patient Safety Act. The Overdose Prevention and Safety Act was a bill that was introduced fairly recently on April 3rd of 2019 by Representative Earl Blumenauer. Representative Blumenauer is a state representative who is a Democrat representing the state of Oregon. The reason why Blumenauer introduced this act is because he wanted to provide a way for overdose prevention patients to have patient confidentiality and privacy of their current situation as they are seeking help. Opioid use, abuse, and overdose collectively constitute one of the most significant and ongoing threats to public health in the United States. Overdose prevention does not only include opioid use, but also the use of alcohol. The most prevalent is opioid use, so that is what the bill mostly focuses on. During the course of the student's education into becoming a medical professional, whether it be a nurse, a pharmacist, a surgeon, or a primary care physician, they're all taught that patient confidentiality is an important aspect in their practice. Medical professionals are obligated to protect the confidentiality of their patients. And with the confidentiality of their patients, this also provides a way for the patients to trust their primary or treating physicians so that they will be open enough to tell their physicians everything that's going on with them. And in that way, they will be provided a treatment that is best for them. The HIPAA privacy rule regulates the use and disclosure of protected health information by covered entities. HIPAA is a code of rules and regulations that protects the privacy of all patients. Now, the disclosure of protected health information can also include sensitive information such as the patient's first and last name, their date of birth, their address, their condition, and or medical and health record information. Privacy issues are paramount for patients with substance use problems due to stigma, discrimination due to their condition, potential prosecution from the public, and loss of employment due to discrimination. There are a lot of prevention patients who try their best to maintain a simple life and try to remain discreet about their condition and their situation as they are trying to find a way to resolve the overdose situation that they're going through. Due to this reason, their information must remain, and they feel that it should remain confidential, with all treating and primary care and all medical personnel altogether, due to the fact that they don't want to become a target in the face of the public, and they would not like for the public to have their information exploited to the world. Breaches of confidentiality in clinical practice due to carelessness, indiscretion, or sometimes even maliciously jeopardize a duty inherent in the doctor-patient relationship. If patients feel like their information is not being kept confidential, then they will become reluctant to provide any information that can be used to help treat them or that can be used for the treating physicians to be able to aid them in their process of prevention. This eventually will cease the trust that the patients have in their providers, and they may feel that they cannot trust any other provider, which then brings them back into the cycle of overdose again, without trying to find any fix or trying to find any way of preventing that within their lives. They will ultimately be reluctant to speak with any primary care physician. Breaches in confidentiality do not only include technological breaches. This can also include any personnel, whether it be a nurse, a treating physician, or any other medical personnel who just speak with another treating physician outside of the scope of the patient's knowledge, whether it be elevator talk, whether it be just locker room talk, any way that the patient's information will be exploited or even brought up in any conversation or a situation without the patient's knowledge or consent becomes a breach in confidentiality. Since the introduction of the bill, there have been 71 co-sponsors who are in favor of the bill being passed. The 71 co-sponsors include 39 Democratic representatives and 32 Republican representatives. The co-sponsors by state are included below. While there are co-sponsors to the bill, there are those who also do have oppositions toward the bill. The Pennsylvania Recovery Organization Alliance, or PROA, gave 10 reasons why they oppose the bill of being passed. Information about substance use conditions is different than other medical information. That is considerably true to some extent, as there are more laws protecting the confidentiality and patience of those who have life-threatening situations or life-threatening conditions such as cancer, HIV, AIDS, and so on. However, there is not much mention about those who are going through overdose prevention and keeping their information as confidential as other life-threatening situations. The PROA also feel that it is unnecessary. Fewer people will seek help, that it is not a barrier to care, and the bill eliminates shared decision making with the patient. Continued oppositions include that HIPAA standards are much weaker. Persons and entities outside of the treating relationship will have access to highly sensitive information. While the HIPAA standards are in place, just as stated before, there are not that many strong indications of the HIPAA significantly protecting the confidentiality of overdose prevention patients. Overdose prevention is a rising issue that is still going on in the United States. However, while it is still a rising issue, there is not much being done towards protecting the confidentiality of the patients who are seeking help and who are seeking prevention. The bill seems to be for EHR, or Emergency Health Records, insurance and provider entity convenience. Clients will be left with few options once their information has been used to harm them. Once a patient feels that, or a client feels that their information may be breached or their information may be left out for the world to know of due to lack of confidential security, they will be reluctant to return to the same treating physician or the same primary care doctor for further treatments. They will also feel that there is not much that can be done in their situation and will be left without seeking prevention care. Providers will still need to tag protected information to patient charts. The elimination of our rights is no substitute for conducting routine assessments and referral for persons at risk for substance use conditions. Nurses have close proximity to patients and can make changes in patient charts alongside the patient's physician. Nurses have close proximity to their patients on a daily basis and know more about their health conditions as they are constantly in contact with the patient and updating patient information almost every day. Nurses also have the opportunity to change patient information concerning their health. With that being said, it is important for nurses to uphold patient confidentiality and keep patient information secure from any breaches that may occur or that may take place. Failing to question an order, failing to call for physician consultation, failing to heed a patient or family request for assistance, and breach of confidentiality are examples of lack of fiduciary concern and can all contribute to causing harm to the patient. When patient information and confidentiality is breached, this can cause a lot of harm to the patient. The harm may not be physically, however, it may turn into a physical harm due to the fact that patients will feel that their information is not secure. They will not reach out to physicians or any practicing medical practitioner to help them in their time of need. The recommendations that I was able to come up with are, with the increasing use of electronic health and medical records, there is more of a need to secure technology to prevent breaches. A breach in confidentiality will result in patient mistrust and unsatisfaction. This is pretty self-explanatory, but what I really meant was that if there's a breach in confidentiality, patients will no longer want to seek help in their condition, and they will no longer trust any primary care doctors, which would question all of the healthcare system physicians altogether. More should be done from healthcare personnel as well as the community to protect the rights of those who are going through overdose programs. There is much that needs to be done in order to secure health and medical records for overdose prevention programs. And it is not an effort that can be done with only one person alone. It only takes one person to make the first step in keeping patient information confidential. However, it takes the whole community and all people to come together to say that overdose prevention patients should also be protected just as much as those who have life-threatening conditions such as cancer, such as fatal diseases, such as HIV/AIDS, because their lives also do matter and their information should also be kept private. Thank you for reading and watching my presentation. I hope that you have learned a lot in this presentation, and I hope you have a great rest of your evening.